Yang udah, asal lah ngusundi sudah penjual hotel lah ngurusin hari.
Iya kan kita join ke sini untuk ngabsen di sini kan.
18, 19, 20, 21, 1
Enggak, di sini nanti siap Inang.
yang maksud satu akun.
Akunnya ini.
Iya lah satu akun kan semua.
Iya bang, akunnya di sana. Apa? Bukan nyari-nyari, kita buka di laptop kita masing-masing baru kita absen. Iya. Abang nanti di sini. Gitu ya?
Iya.
Iya. Apa nyari-nyari dulu sini ya? Cari namanya yang sini. Udah susah. Maksudku kenapa tuh bukan join? Iya. Itulah buka kena di situ bertemu langsung kalau itu.
Bentar ya, bentar.
Enggak.
Selamat pagi dan salam sejahtera buat kita semua yang ada di grup Zoom ini, di mana hari ini Sabtu 16 Oktober 2021 kita akan mengadakan acara guest lecture dengan topik Physiology and Pathophysiology of Gastrointestinal Infection, di mana acara kita ini dibagi dalam dua bagian. Yang pertama adalah opening ceremony dan yang kedua penyajian materi. Acara kita akan dipandu oleh moderator Dr. Laura Pancasusila Tambunan, MKes, MKet Neuro, spesialis neurologi. Beliau
Masuk kau belum anjing? Isu ayah. Mana background ini banyak, coba diam kau dulu.
baik, sedikit ini kita akan tampilkan kurikulum vitae dari moderator kita, yaitu Dr. Laura Pancasusila Tambunan. Dengan riwayat latar belakang pendidikan, beliau tamat atau lulus dari Fakultas Kedokteran Universitas Methodist Indonesia tahun 2009 dan menempuh pendidikan Magister di Public Health Science Universitas Sumatera Utara lulus tahun 2016 dan melanjutkan pendidikan Magister in Clinical Medicine of Neurology dari Universitas Sumatera Utara lulus tahun 2018 dan selanjutnya menyelesaikan pendidikan Neurologi Residence Program dari Universitas Sumatera Utara tahun 2021. Dengan riwayat pekerjaan tahun 2010 sampai 2011 menjadi dokter di Jehuda Medical Center Medan tahun 2011 sampai tahun 2012 menjadi dokter di Kabupaten Mogang, Puskesmas Mogang, Republik Indonesia. Dan selanjutnya melanjutkan pekerjaannya pada tahun 2012 sampai dengan tahun 2016 di Rumah Sakit Sarah, Medan. Dan beliau juga dari tahun 2012 sampai 2016 merupakan dosen di Fakultas Kedokteran Universitas Methodist Indonesia. Dan selanjutnya, waktu akan kita berikan kepada Dr. Laura Tambunan. Persilakan, Dok.
Terima kasih, Dr. Evi Rosa. Good morning, ladies and gentlemen. Thank you to everyone for being here on this wonderful morning. First of all, let us praise and thank the presence of God Almighty for the abundance of grace and the joys of all us can still in this time without any barrier and in good health. Therefore, I would like to introduce myself. My name is Dr. Laura Tambunan, MCAS New Specialist Neurology. It is such an honor for me to speak as moderator in this event. Let me begin by giving you a warm welcome to the guest lecture, Physiology and Pathophysiology of Gastrointestinal Infection, Bacterial Host Infection. Before we get started, I would like to express my appreciation to the Hannes, the Deputy Dean of Medical Faculty, Universitas Methodist Indonesia, Dr. Andy Julianto, MKT, IFOKA. Thank you for your presence, Dr. Andy. I also welcome to all lecturers, students, and all audience. Now, we will start this event by singing the national anthem with wisdom and respect. Let us sing the national anthem, Indonesia Raya. I'm sorry, the voice is not loud. I think the admin can replay it. With wisdom and respect, let us sing the national anthem, Indonesia Raya. Thank you to admin. Everything that is good should start by giving thanks to God. Let's start our event guest lecture with a prayer, which will be led by Ibu Pendeta Rustina Ginting STH. To Mrs. Pendeta Rustina, floor is yours.
Ya. Mari kita berdoa. Bapa di sorga, kami bersyukur ya Tuhan pada hari ini rangkaian acara kuliah tamu yang diadakan di Fakultas Kedokteran Universitas Methodist Indonesia pada saat ini dapat berjalan dengan baik ya Tuhan. Marilah Engkau memberkati. Engkau ya Tuhan yang memberkati mereka yang ambil bagian di dalam rangkaian acara ini, yaitu Dr. Endi Julianto, MKT Alfoka. Mari ya Tuhan, Engkau memberikan hikmat bijaksana yang datangnya dari Tuhan. Dan juga moderator, Dr. Laura Pancasusila Tambunan, MKT FPN. Tuhan memberkati, sehingga melalui kata sambutan dan juga yang dipimpin oleh moderator pada hari ini, semua rangkaian acara boleh berjalan dengan baik. Dan secara khusus ya Tuhan, pembicara atau speaker, Dr. Vimalah Devi Gengaturai, MSc Medical Physiology. Mari Tuhan Engkau memberkati, yaitu dengan topik Physiology and Pathophysiology of Gastrointestinal Infection atau Bacterial Host Infection. Biarlah ya Tuhan melalui pembicara yang akan memberikan yaitu hal-hal yang menyangkut penyakit ya Tuhan. Semua yang mengikuti seminar, mereka boleh diberkati karena hikmat Tuhan. Engkau memakai Dr. Vimalah Devi yang dari Malaysia ya Tuhan. Memberikan pengetahuan yang lebih luar biasa lagi ya Tuhan. Sehingga peserta seminar pada hari ini mempunyai pengetahuan yang baru. Mari ya Tuhan Engkau memberkati rangkaian acara kami serahkan ke dalam tangan-Mu. Di dalam nama Yesus kami berdoa. Amin.
Thank you, Mrs. Pendeta Rustina. Before we get into the main event of guest lecture, let's listen to the welcome speech from the Hannes, the Deputy Dean of Faculty of Medicine, Universitas Methodist Indonesia, Dr. Endi Julianto, MKT IFOKA. To the Hannes, Dr. Endi, the floor is yours.
Thank you. Thanks to moderator. For the first, the honorable guest, Miss Captain Dr. Vimala Devi Kengaturai, Master of Science, Medical Physiology, lecturer in Unit of Physiology, AIMS University, Malaysia, as a keynote speaker in this visiting lecture today. The second, the committee of this event that has been quite hard. And the third, all participants of this visiting lecture. Good morning, ladies and gentlemen. Medical Faculty, Universitas Methodist Indonesia has been developing itself to be a qualified medical faculty in a global, universal sphere, especially in infectious disease as written in its vision. Along with the effort to be a qualified medical faculty, that alumni's quality is not only based on the raw input, but also by the campus learning process. Many efforts has been conducted. Having a visiting lecturer from overseas, we expect to enhance the learning quality and to share her experiences in person to our students in order to widen students' international views and to enable our lecturers to network. Our visiting lecturer today is Miss Captain Dr. Vimala Devi Kengaturai, Master of Science, Medical Physiology, lecturer in Unit of Physiology, AIMS University, Malaysia, will give a lecture about physiology and pathophysiology of gastrointestinal infection. This topic is, I think, is quite interesting, so that we expect all students will learn it seriously. And that's I say hi Vim. That's my friend. She is my friend. My colleague friends. 04 ya. I say in bahasa 04 Stambuk 04. 04B ya Vim ya. Thank you, my friend from Malaysia, who is willing to give knowledge public lecture for this today guest lecture. Last but not least, I wish you all a good time in joining this visiting lecture. Thank you.
Thank you very much, Dr. Andy. Now, okay, thank you very much, Dr. Andy. Now we come to the main event of the guest lecture with the topic physiology and pathophysiology of gastrointestinal infection, bacterial host infection. We know gastrointestinal infection, especially diarrheal disease, are responsible for substantial morbidity and mortality worldwide. There are number that cause gastrointestinal infection, one of which is bacterial. As a medical doctor, we must know how to diagnose this and treat this. But first, that is very important, we must have knowledge about the physiology and pathophysiology of gastrointestinal infection. On this event, we are very grateful for the presence of a beautiful and smart speaker from Malaysia, Captain Dr. Vimala Devi Genganturai, Master of Science Medical Physiology. According to Indonesian poem, tak kenal maka tak sayang, if you don't know, so you don't love it. So allow me to present a curriculum vitae of Dr. Vimala. Captain Dr. Vimala Devi Genganturai, Master Science of Medical Physiology, is the lecturer in Unit Physiology, AIMS University of Malaysia, with 5 years teaching experience and 2 years research experience. She graduated medical doctor from Universitas Methodist Indonesia in 2011 and Master of Science with Field Medical Physiology from AIMS University in 2015. Working experience as a doctor in Ampang Hospital in 2012 and 2014. Teaching experience as a lecturer in AIMS University in 2012 till now. Her research work is entitled as follows. First, short and long term of trigonelline and psychomotor behavior and biochemical parameters in sporage dowry rats in 2020. And second, short-term effect of pyrroloquinolin on cognitive and behavioral in zebrafish as a model in 2021. And her publication with the title Experience of Menstrual Irregularities in a Rural Area of Kandat State, Malaysia in 2019. Well, I think she had a great experience. And what I am very proud of her, she is an alumni of our beloved campus, FK UMI. Good morning, Dr. Vimala. How are you, doctor?
Very good morning, Dr. Laura. Thank you so much.
Yes, nice to meet you.
I'm good.
Okay, nice to meet you, doctor. I think we haven't seen each other in a very long time. I think it's around 12 years, doctor.
Yes, doctor.
Okay. I remind, I think before start your presentation, I remind to all students and audience, this guest lecture topic is very important. I really hope students really listen to it. And this opportunity is very limited. I hope that all students and audience will prepare the question that will be asked in this discussion session. Thank you very much. And to Dr. Vimala, it's around 1 hour until 10:15 a.m. Doctor, please allow time and place. Floor is yours, doctor. Thank you.
Thank you very much. Okay, a very good morning to one and all. I would like to express my sincere thanks to respected Deputy Dean, Dr. Andy Julianto, also a friend of mine. Okay, apart from that, I would like to thank the organizing team. And also, I'm proud to be back here as an alumni. And not to forget our moderator for the day, Dr. Laura, for her excellent job as always. Okay, very impressive and well prepared for a great start. And last but not least, for the dear future doctors, how are you all today? It's a great pleasure to meet all of you today. Okay. So I think I will share my screen now. Okay, is my screen visible to all of you?
We can see it there, Doctor.
All right, okay, thank you. So my topic for today is physiology and also pathophysiology of gastrointestinal infections, which is most common that we call as a bacterial host infections. Okay, so when we want to talk about physiology and pathophysiology, so overall, when we look into it, we know that the overall functions, okay, functions of gastrointestinal tract may be considered, okay, as the movement of food through our GIT tract, the secretions of digestive juices, digestions of our consumed food, and also finally after the digestion, it continues with absorptions of products of digestions, water, electrolytes, vitamins, and minerals as well. And here, when we talk about infections, over 200 million episodes in a year of infections of gastroenteritis in US and as well as worldwide. Like about 3 to 6 million of children die each year from infectious gastroenteritis. So here the outbreaks of gastrointestinal infections are the most serious concern in hospital environments. Okay. And gastrointestinal infections are most common in viral, bacterial, parasitic infections, which that cause gastroenteritis. And also inflammation of this gastrointestinal tract involving both stomach and also small intestine. And the most common symptoms when we talk about gastroenteritis, GIT infections, it must include diarrhea, vomiting, abdominal pain. And apart from that, we also must know that dehydration, okay, not only that the symptoms which I mentioned before, but also dehydrations is the main danger of gastrointestinal infections. So rehydration, because we know when there are dehydration, we need to stable it back by rehydration. So here, rehydration is important, but most gastrointestinal infections are self-limited and resolve within few days. Okay, because we know from dehydration, we know the stages of dehydration. It can be from mild to moderate and severe. So mild and moderate, usually it is self-limited. When it comes to severe dehydration, yes, definitely we need to seek for medical attention. Okay, now the second one is the overall functions of GIT tract. So the overall function of digestive systems, okay, in the diagram below, we know it is from the ingestions of the food. So here the mechanical breakdown, it involves the chewing, which is involving your mouth. Okay, then kerning for stomach and followed by segmentation, that is involving your small intestine. The food, okay, the food which is passing through your pharynx, esophagus. So here the propulsions is started with the swallowing, okay, which involving the oropharynx and continued with peristalsis. Okay, we call also as a peristaltic movement. So it involves your esophagus, stomach, small and also large intestine. So digestion always occur, okay, starts from your small intestine up to large intestine. Okay, from the digestion, absorptions will also lead to the blood vessels as well as lymph vessels. And the main water will absorb from large intestine. And finally, all the waste product will expel out through your anal region. Also, we call as the defecations. And here the volume. Okay, the volume where you start with the ingestions, it's about 2 liters. Okay, not only ingestions, by the help with salivary gland secretion, it's about 1 liter. Okay, so here I would like to ask one question. When we talk about salivary gland, how many glands are there to produce your saliva? Can I get a quick answer from the participants? How many glands are there? You can unmute yourself and answer, or also you can put it in a chat box. Guys, are you all there? Are you all with me?
Okay, I think the student, can you put the answer of the Dr. Vimala in your chat, please?
Yes, the salivary gland. When we talk about salivary gland, how many glands are there? It's a very simple question. How many glands are there? Okay, so okay, never mind. So I will tell you the answer. So salivary glands, it's involving 3 main glands, which is parotid gland, submaxillary, and also sublingual gland. Okay, so from these 3 glands, the salivary secretion, it's about 1 liter. Then we move on to the gastric secretions. It is about 2 liters. Okay, bile products, usually bile and bile products will secrete about 0.7 liters. Pancreatic juices, the secretion here, it's about 1.2 liters. In small intestine, the secretion is about 2 liters. So you can imagine all the secretions here. Okay, start from ingestion up to small intestine. All the ingestion secretion here being absorbed in small intestine about 92%. Okay. After 92% being absorbed in small intestine, move on to the large intestine, which is only the remaining about 6 to 7%. And finally, the last remaining, which is about only 1% in feces. Okay. Okay. Now here the cross sections of interstitial wall. When we talk about the cross section interstitial wall, this wall is made up of 5 layers. Okay, so we will see from the outer towards the inner part of the layers. So it starts from serous, which is connective tissue layers, and also peritoneum. So the second one will be the longitudinal muscle layer. Okay, and continued with circular muscle layer. And it goes to the submucosa. And finally to the mucosa layers. So here in mucosa, you can see the mucosa epithelium, lamina propria, and also muscularis mucosae. So these are the cross-sectional of intestinal wall. And we know that our gastrointestinal wall, GI tract wall, is made of smooth muscle and also longitudinal and circular muscle layers and fibers. Okay. And now here is the overview of interstitial functions. Okay, we start from mouth. So mouth, we know there is a salivary gland with the secretion of saliva. So here where it starts the initial of digest. Okay, basically the cooked starch will start from mouth itself. Then move on to stomach, where the initial digestions will start, the digestion of protein. Then to duodenum, Duodenum is where the secretion of bicarbonate and mucose continue with the digestion of carbohydrates, proteins, fat by enzymes of pancreatic juice, and also in duodenum, absorptions of iron, calcium, copper, fat, and also soluble vitamins. Okay. So if you know the answer for the soluble vitamins, maybe you can put in a chat box. So what is the soluble vitamins? Okay. Then continue with jejunum. Jejunum here also the continuation of digestions, and here the absorptions of end products of digestion will occur. And here also the absorptions of water. After jejunum, we follow with the ileum. Ileum is also the continuation of the further digestions, okay, further absorptions, and here in ileum, absorptions of vitamin B12 and bile salt will occur. And after that, lastly, the colon. Here, the water absorptions also followed with soluble vitamins and excretion of feces by the defecation reflex through the rectum. So here is the overview of intestinal functions. And here we will talk about the enzymes. Okay, before we move on to further in detail, so you also must know what are the enzymes involved in GIT tract. So saliva, we start with saliva. So we know the enzyme is amylase. Okay. Gastric juice is pepsinogens. In pancreatic juices, okay, you can see amylase, proteolytic enzymes, trypsinogens, chemotrypsinogens, pro-carboxypeptidases A and B, lipase, cholesterol esters, ribonucleases. Okay, move on to intestinal secretions. Here you can see enterokinase, maltase, lactase, sucrase, dipeptidases, and also aminopeptidases. Okay, let's move on to the infections. So now, before this, we already learned the overview, the physiology view of gastrointestinal tract. Starts with the functions, overview, secretions. Okay, now the infections. So when we want to talk about infections, basically the developing countries shoulder a considerable burden of gastroenterological disease because we are all still in the developing countries. So here infectious disease in particular cause enormous of morbidity as well as mortality. So diseases, when we talk about diseases which afflict both Western and also developing countries, are often seen in more florid forms in poorer countries. Okay, when we compare to the Western. So here, the innovative techniques continuously will improve and also update the gastroenterological practice. So for the concern here, the clinical guidelines based on this advanced and also collected in resource-rich environments, they lose their relevance outside these settings. However, advances in diagnosis and treatment, which are commonplace in West, have yet to reach many developing countries. It is a very sad evidence or sad prevalence that we need to know that we still have yet to reach as far as the Western countries. So when we talk about infections, we need to know about the clinical significance. So when it comes to gastrointestinal infections, so the clinical significance, okay, it starts with vomiting and nausea. So when there is a vomiting and nausea, we should think what are the cause, what are the clinical significance that can cause this vomiting and nausea. So it comes in our mind. The first thing comes in our mind is food poisoning. So because this is very common because we are going here and there, we are getting food from outside. Okay, so food poisoning is the most common. And then after that, gastritis, ulcer, gastroparesis, overeating also can cause vomiting and nausea, gallbladder disease, and also bowel congestions. apart from vomiting and nausea, now we move on to the weight loss. What are the clinical significance in weight loss? Usually inflammatory bowel disease, cancer, and also stomach ulcer. Then the next is fatigue. Okay, we feel tired, fatigue. So fatigue, the clinical significance for fatigue in GIT is irritable bowel syndrome. And the last one is recurrent upper abdominal pain. So when we talk about GIT, gastrointestinal, okay, tract, always GIT and GIT infection. Okay, the common is upper abdominal pain. So this pain, the cause can be caused by gallstones, gastritis, strained or pulled abdominal muscles, irritable bowel syndrome, cancer, and also stomach flu. So these are the common clinical significance that we need to know before we come up with our diagnosis. So we need to take a proper history, okay, proper clocking the cases, proper history, proper examinations, and we come up with the clinical significance before we conclude with the diagnosis. Now, when we know the clinical significance, we also must know the bowel habit. Okay, this is interesting because the bowel habits always describe on a person's bowel movement. When we talk about movement, you must know the frequency of bowel movement each day. Okay, the control over the during the movement and also the consistency and color. So here, alteration in any of these habits over the course of a day will represent a change in bowel habits. So the healthy bowel movements frequency is about 3 times a day to 3 times a week. This is the healthy bowel movement. The normal consistency color of bowel movement is brown, soft to firm in texture, and easy to pass. And here I attached the Bristol stool chart where there are few types of stools, 1 to 7. If you look into the type 1, it is the separate hard lumps. So it shows the patient is having very constipated conditions. So if we are in a very constipated conditions, our stool becomes separate and hard lumps. The type 2 is lumpy and sausage-like, and it shows that slightly constipated. Type 3 and 4 is normal. So type 3 is sausage shape with cracks in the surface. Type 4, like a smooth, soft sausage or snake. And to share with you, and I really don't know why we are always define it as a sausage when it comes to stool. Okay, even the Bristol stool chart also saying that it's like a sausage. Okay, so type 5, it is a soft blobs with clear-cut edge. Okay, it shows that patient is having lacking fibers. Type 6, it's a mushy consistency with raised edge, like it is inflammation. And the type 7, it is liquid consistency with no solid pieces. So it's more to inflammation and diarrhea. So we must know the bowel habit and also the stool chart. Easy for us to make a conclusion or diagnosis. Now infection. After the stool chart, now we know we can move on to the infections. When we want to talk about the infections, so overall, we start with the bacterial gastroenteritis. When we want to know about the bacterial gastroenteritis, we must know the good and also bad bacteria. Okay, the good bacteria in our gut is bifidobacteria, E. coli, lactobacilli. The bad bacteria is Clostridium difficile, Enterococcus faecalis, and Lymphobacter. So these are the few good and bad bacteria in our gut. So we start with the definition. Okay, for gastroenteritis, we know it is a syndrome. Okay, it is a syndrome which involving our stomach as well as small intestine. So this gastroenteritis characterized by gastrointestinal symptoms. So when we talk about the symptoms, remember the first slide I told you, the gastrointestinal symptoms always including nausea, vomiting, diarrhea, and abdominal discomfort. So these are the characterized. And diarrhea, as a definition, it's an abnormal fecal discharge. It is characterized by frequent and or fluid stools. So usually diarrhea resulting from disease of the small intestine and involving increase in fluid and also electrolyte loss. And the next is dysentery. Dysentery is an inflammatory disorder. It is an inflammatory disorder of gastrointestinal tract, often associated with blood. Okay, the highlight here is blood and pus in your stool. Okay, so your feces, okay, mixed with blood or pus. And also, not only that, it accompanied by symptoms of pain, fever, abdominal cramp, and also usually resulting from disease of large intestine. And the next one is enterocolitis. Enterocolitis is an inflammation which involving the mucosa of both small and also large intestine. So let's look into it one by one. So when we talk about diarrhea, so according to WHO, we must have the evidence. So according to WHO, diarrhea is defined, okay, it is defined as a passage of 3 or more loose stools per day, or passing more stools than normal for the age. So usually if you're passing more than 3 times per day, okay, you are defined as having diarrhea. So there are few classifications. So the first classification of diarrhea on the basis of durations. So we must differentiate the duration, whether the patient is having acute or chronic diarrhea. So when we want to talk about acute diarrhea, okay, the days will be much more shorter. It can be 3 to 5 days or less than 7 days. When it is a chronic diarrhea, yeah, it is more than 7 days. So the basis of duration, yes, it is acute and chronic. The second one is basis of clinical presentation. So when the patient is having diarrhea, you also must check whether the patient is having watery diarrhea or bloody diarrhea. That is important. Okay. And the third one on basis of physiology. So if the basis of physiology here, you start with the secretory diarrhea, osmotic diarrhea, exudate diarrhea, motility related, and also inflammatory diarrhea. So these 3 things, these 3 classifications are important for you to rule out diarrhea. The common causes, okay, as a secretory, we start with the secretory diarrhea. So this secretory diarrhea occurs with drugs that inhibit the sodium potassium ATPase. So example of the drug like digoxins. Or also to stimulate the epithelial chloride, okay, secretions like examples, misoprostol. So these are for the secretory diarrhea. So the next one is osmotic diarrhea. For the osmotic, the common is with drugs like lactulose in patients for undergoing an enteral feeding. Okay. And the third one is for the inflammatory diarrhea. So when we talk about inflammatory, it involves all the inflammation caused flow of the luminal content into intestine. And also not only that, for inflammatory, the using of NSAIDs, chemotherapy, patient are getting chemotherapy, okay, ergotamine, cocaine are most common causes for inflammatory diarrhea because it can disrupt all the luminal wall of your intestine. Okay. Now we can see from the type to cause, tests, effect, and examples. Okay. When we want to know or we talk about the osmotic, the causes, yeah, we discussed with the excessive osmotic forces. Okay. So the test usually the level will be more than 125 milliosmol per body weight. And the effect of fasting always relieved by fasting. And the examples like here, lactase, deficiency in lactulose, PG. PG means the percutaneous endoscopic gastrostomy. And apart from that, also magnesium citrate. The second type, secretory, which will increase the electrolyte secretions. Okay. The third one, malabsorptions. Okay. Also generalized in failure of nutrient absorptions, unable to absorb. So you can see in your stool all the fat, okay, without absorption, where fat will be mixed with your stools. We call as a steatorow. And the fourth one is exudative. This exudative is due to inflammatory disease or invasive infections. Okay, so you can look at the chart here with the test, effect, and also examples. Okay, let me move on. So, diarrhea. So, diarrheal disease can be caused by bacteria, which is the most common, virus, parasites, and also fungus. So, you can see from bacteria, this much of bacteria are there for virus, parasites, and also fungus. So now let's look into the types of pathogens in bacteria, where we need to divide it into two groups. First is invasive bacterial pathogens, and the other one is non-invasive. So in invasive, there are Salmonella species, Campylobacter species, enterohemorrhagic E. coli, enteroinvasive E. coli, Vibrio parahemolyticus, Yersinia enterocolitica, and also Shigella dysenteriae. That is for invasive. For non-invasive, starts with the enterotoxigenic E. coli, pathogenic, enteropathogenic E. coli, Vibrio cholera, Clostridium perfringens, Staphylococcus aureus, Bacillus cereus, and Clostridium difficile. So these are the types. So let's talk about E. coli. So the pathophysiology of E. coli. So here, the enterotoxigenic E. coli, you can see here the picture here, it binds loosely via all the fimbriae. So it can secrete the toxins like cholera toxins also. So when it secretes into the gut, then it will gain entry to the cell without any disruptions of the cytoskeleton. So it just go inside easily without any disruptions. That is type A. Okay, that is type enterotoxigenic. When enteropathogenic, it will destroy. That is the difference. Enteropathogenic E. coli, you can see the B here, it will destroy the brush border of microvilli. You can see here the brush border of microvilli. So it will destroy it and it becomes very firm and attached through the pedestal, which consisting of actin and also actin binding proteins. So the third one, this is enteroinvasive E. coli. So this enteroinvasive, it gains entry into cells. Okay, it goes inside the cell. Okay, entry into cell, it escaping from immune system by digesting the phagolysosome. So phagolysosome, we know it is a digestive vesicles. Okay, it formed within a cell. Okay, by the fusion of phagosomes. Okay, which containing all the ingested material. That is phagosomes. Okay, then also it can grow. You see, it goes inside. Okay, it can grow. And it can divide in cytoplasm and gain entry to the neighboring cells. Not only one cell, it also can attach or enter the neighboring cell by bursting through and also digesting membranes. And the last one, the D, that is enterohemorrhagic. So it operates same like pathogenic as well, but in addition, Shiga toxins, it's a type of toxins. Okay, so Shiga toxins liberated that the epithelial cells will take up and also then taken to Golgi. So these toxins then travel from Golgi to endoplasmic reticulum, where when it can travel from Golgi to endoplasmic reticulum, it will then destroy the ribosomes. So when it destroys the ribosome, this results in the death of the cells. So this is what happens when E. coli goes untreated. Okay, so when E. coli goes untreated, infection may lead to disability or death. So you can see the large amount of hemorrhagic or blood in your stool. Okay, when the large amount of blood in your stool, large amount of water, definitely dehydration, and it can lead to hypovolemic shock as well. Okay. Now let's move on to gastroenteritis. So when we talk about gastroenteritis, it is a group of syndrome. Okay, it's a syndrome. So this syndrome involving stomach and small intestine. So the characterized by the symptoms including nausea, vomiting, diarrhea, and abdominal discomfort. Other name for gastroenteritis also known as stomach or interstitial fluid. So this gastroenteritis is caused by bacteria. Types of bacteria: Salmonella, okay, will cause salmonellosis, shigellosis, bacterial toxins, E. coli infections, and also Campylobacter infections. So here in salmonellosis, these bacteria are found in animal feces. So infection caused by eating or contaminated food, handling infected animals, okay? An infected person also can spread the bacteria to the other persons or surfaces by not washing their hands properly. This is how patient get contaminated. For the shigellosis, also same, the bacteria found in feces, okay, animal feces. Infected persons spread the bacteria through the food or surface if they don't wash their hands after going to toilet. Okay. The bacterial toxins, the next one. It is the poisonous byproducts caused by bacteria who can contaminate food. So here, some strain of staphylococcal bacteria produce toxins that can cause gastroenteritis. For E. coli, it is common problems for travelers, okay, very common in travelers to countries with poor sanitation. Infection is caused by drinking contaminated water or eating contaminated raw fruits and also vegetables. Okay, and another one is Campylobacter infections. So these bacteria are found in animal feces. Infection is caused by, for example, like you are consuming contaminated food or water, and also maybe you are eating uncooked food, okay, uncooked meat, especially chicken, not washing your hands after handling infected animals. So these are the reason or cause for these contaminations for gastroenteritis overall. And now dysentery. So dysentery also intestinal inflammations and primarily for the colon. Okay, it also can lead to mild or severe stomach cramps and severe diarrhea with mucus or blood in feces. So without adequate hydration, definitely it can lead to fatal. Okay, infections with Shigella bacillus or bacterium is the most common cause. So here the most common bacteria is Shigella for dysentery. Enterocolitis. Enterocolitis is actually an inflammation that causes in a person's digestive tract. So this condition specifically will affect the inner lining of both small intestine as well as colon. So small intestine and also large intestine. Okay. So this enterocolitis is causing several symptoms. Enteritis is the inflammation of small intestine, while colitis is inflammation of colon. So both joined together, that's why the name is enterocolitis. And the most common bacteria for enterocolitis is Campylobacter, Shigella, Salmonella, E. coli, and also Yersinia. So these are the commonly encountered pathogens causing bacterial hemorrhage, enterocolitis, and also result of fecal oral or food and water contaminations. So I'm just adding a picture here. You can see here, this is the clinical abdominal findings in advanced necrotizing enterocolitis, okay, where it illustrating distended erythematous abdomen with cellulitis. And here the gross pathology of necrotizing enterocolitis illustrating the hemorrhagic and ischemic intestinal necrosis. You can see here the hemorrhage, okay, the hemorrhage intestinal necrosis. Now let's move on to cholera. Okay, we call as a Vibrio cholera. So Vibrio cholera is an acute infection of gastrointestinal tract. So this caused by coma-shaped gram-negative Vibrio cholera. So very easy to identify in microscopic view. Okay, because the shape of this bacteria is coma shape. So this is type of gamma proteobacteria, and also distinguishing factor here, the oxidase positive, and also motile via polar flagellum, and also both respiratory and fermentative metabolisms. So this organism can multiply freely in water. Okay, can multiply freely in water. So that's why the disease is spread by a contaminant of food and water. So mode of infections, fecal-oral route, the feces or vomitus of human cases are the carriers. And cholera flourishes in communities with inadequate clean drinking water. So that's why the clean drinking water is very important. And the incubation period is very fast, just from a few hours up to 5 days. And commonly it's about 1 to 2 days. The common symptoms, okay, common symptoms like watery diarrhea, nausea, vomiting, and dehydration. Yes, of course, because patient is having nausea, vomiting, diarrhea, so definitely dehydration will be there. So that is considered as a common symptoms. If we move on to the severe symptoms, yeah, involving muscle cramps, rapid heartbeat, low pressure, and persistent vomiting. You know why there is a severe symptoms after common symptoms? Because of dehydration. When the patient is having severe dehydration, it leads to muscle cramps, rapid heart rate, low blood pressure, and also persistent vomiting. Okay, not only that, also can lead to convulsion. So how the pathogen invades in the body? So cholera is potentially epidemic and life-threatening secretory diarrhea. So this characterized by numerous voluminous water stools. So multiple times patients are going in and out, okay, because of the loose stools, and often accompanied by vomiting resulting in hypovolemic shock and also acidosis. Source of infection. So water or food contaminated with cholera. In epidemic, feces of diseased person. So patient is having cholera, their feces also can be a route of contaminated to others. Treatment, always ORS solutions, okay, intravenous fluid and antibiotics. Risk of infections here, the risk of death among those affected is usually less than 5%, but maybe can be as high to 50% as well. And the more specific one here with the cholera, so when the bacteria is in large intestine, the bacteria can multiply rapidly. So when it can multiply rapidly, bacteria will release the cholera toxins. So when it releases the toxin, the toxin will penetrate into the intestinal wall. When it penetrates there, it prevents. So like it the toxin already prevent in the wall. Okay, so the wall is being covered with the toxin. So it prevents the absorption of water by the intestine, leading to hypovolemic shock and dehydration. Because the wall unable to absorb the water. That is the reason. Okay. Now shigellosis. See how beautiful the bacteria is. Okay, the color, the shape, but yes, unfortunately, it's bacteria. Okay, shigellosis. So when we want to talk about shigellosis, the source which we need to remember is 4P. Sorry, 4F. Okay, 4F. That is first food, flies, fingers, and fomitus. Fomitus is door handles, like door handles, water taps, lavatory seats. Okay. So the contaminated food like salads, raw vegetables, milk, and dairy products, meat, contaminated water. So see here, from 10 to 100 bacilli, it's just enough to initiate infections. We no need to wait for thousands of bacilli. Just about 10 to 100 is just enough. And the transmission, yes, fecal-oral contaminations. So remember this 4F, food, flies, finger, and fomitus. The incubation period, usually less than 48 hours. Okay, symptoms, abdominal cramps, diarrhea, fever, vomiting, blood, pus, or mucus in stools. So here the bacilli invade in colonic epithelial cell by virtue of type 3 secretory system. So when we talk about type 3 secretory system, it is enable of gram-negative bacteria. It's to secrete and also inject the pathogenicity proteins into the cytosols, okay, of your eukaryotic cells. Then cell-to-cell spread of infections will be there. Infected cells are killed. So here inflammatory reactions will develop in submucous and also lamina propria. When it develops there in submucous and lamina propria with resultant necrosis and ulcerations of the epithelium, but it is mostly superficial, okay? And also the bacilli do not invade inner layers. That's why mostly superficial. Okay, stool contains mainly blood and mucus because already necrosis resulted in necrosis and ulceration in the superficial. So that stool always contains blood and also mucus. Now let's move on to the next one, which is NTS, also we call as a non-typhoidal salmonella. So this is the general characters of NTS caused by salmonella enterocolitis or gastroenterocolitis or salmonella food poisoning. So NTS are primarily animal pathogens. It is gram-negative rods and motile with peritrichate flagella, okay, or flagella. So it is basically the uniformity of the distributed over the body. So it will distribute uniformly over the body. Okay. So you can see here the common cause of foodborne disease. Okay. So the species are Newport, Typhimurium, Enteriditis, Dublin, Indiana, and Heidelberg. So these are the non-typhoidal salmonella types. Okay, the source here always the animal products like poultry, meat, eggs, milk, and also milk products. Okay. The route is fecal-oral, which is direct or also can be indirect, and commonly contaminated items like meat, eggs, water. Okay, fecal material is from reptiles, chickens, ducklings, livestock, dogs, cats, and also adult poultry. So here, the moment we ingest the food, okay, it will invade the microbes of the cells and further in will multiply in macrophages and also lymph node, and it will survive in the bloodstream. When it is in the bloodstream, can produce 2 enterotoxin. Here, the moment you ingested the organisms, okay, you are eating or you are drinking, you are eating, okay, the food is contaminated, okay, the organism is there. So the organism can colonize in the lower intestine. Okay, the main target here is ileum and also cecum, okay, in your lower intestine. Then the mucosal invasion will be there. When the invasion there, cytotoxin, okay, release the cytotoxin. So direct toxic of this type cytotoxin, it can disrupt the effect of certain cells in your body. Okay, then acute inflammation will occur. Acute inflammation, you can be the ulcerations. Okay, also the prostaglandin synthesis will be there, enterotoxins, cytokines. So here will activate, okay, activation of adenyl cyclase. Okay, then the fluid production will increase the fluid production in large as well as small bowel and lead to diarrhea. So these are the pathogenesis. Okay. The next one, I would also like to touch about Helicobacter pylori, H. pylori. Okay. So Helicobacter pylori, it's the infections which occurs when H. pylori bacteria infect your stomach. So this usually happens during childhood. And also it's a common cause of peptic ulcer. So most people with H. pylori infections will never have any sign or symptoms, but it is not clear why it is. Some of people may be born with more resistance to the harmful effects of H. pylori. So this H. pylori may be present in more than half of people in this world. Okay, when we look into the morphology and also pathogenesis, it is the gram-negative. Okay, features like flagellum provide motility. Okay, lipopolysaccharides, where the cell-cell additions molecules are there, additions of to wall to the entrance. Okay, it also produces the exotoxins. So for the H. pylori, 2 types of exotoxin, that is VEC-A and CAC-A. So these exotoxins basically apoptosis to cell and also disrupt the integrity of the cells and the structure, which leading to inflammations. And urease, which it converts urea and water to carbon dioxide and ammonia. And also it can neutralize the stomach acid. So when the urease breaks down urea to carbon dioxide and ammonia, so here the gastric acid becomes neutralized. Okay, able to neutralize the gastric acid. So when when the acid is neutralized, damage to the mucous layer of the stomach will occur. So from here, bacteria will move towards the epithelial lining of antrum, and it can release the toxins, the endotoxins, and able to damage the lining of the stomach. This is how H. pylori travels. Okay, so we are done with the bacteria infections. Now we are moving on to the preventions. So we know that many gastrointestinal illnesses are highly contagious, but there are many steps that a person can take to prevent them from spreading. Am I right? So here, the Center of Disease Control and Prevention with the trusted source recommended a person to do the following prevent of viral infections. Okay, the main and foremost, like wash hands well with soap and water, not substitute alcohol-based hand sanitizer for hand washing. You can practice the food safety, including washing fruits and vegetables and cooking meats. Avoid cooking or preparing food to another person while ill. So when you are sick, when you are not well, don't go and prepare food for another person. These all are basics, okay? Disinfectant hard surface with bleach. Okay, the floor. Hard surface here means like floor, example at your home. You need to disinfect it. And also carefully you launder clothes and also linens. And to avoid a bacterial gastrointestinal infections, again, like the thing which I mentioned, you need to wash hand. You also need to separate the raw meats, seafoods, poultry, and eggs from prepared food. Don't go and keep both cooked and uncooked together. Okay, cooking food to a safe internal temperature. And also make sure avoid undercooked food. Because nowadays we are very keen with the Western foods. We like to eat Western foods. Okay, we like to eat like maybe grilled chicken, grilled meat. So basically all these grilled items sometimes depends, they are undercooked. So make sure to avoid all that undercooked meat. and refrigerate below 40 degree Fahrenheit or 4 degrees Celsius within 2 hours of cooking. Don't keep overnight and eat again for the next day. Okay, that is totally wrong. Okay, and also people who are at the higher risk of gastrointestinal infections and their complication should also avoid undercooked or raw foods from animals, unpasteurized dairy products. Okay, for example, you are claiming that you're drinking fresh milk. Okay, and pasteurized milk. Also, you need to avoid. Okay, sometimes with the when you're having any complications. Okay, to avoid a parasitic gastrointestinal infection, also you need to avoid, okay, you should practice a good hygiene, avoid contaminated food and water, use cautions when traveling to areas where parasitic infections are more common. Okay, another point is to prevent toxoplasmosis also, especially including avoiding the cat litter box if pregnant. Okay, now the last part, which is we are here now with the COVID era. So the GIT infection during COVID era. So as we know, in February 2020, WHO designated the disease COVID-19 as a coronavirus disease 2019. It's a pandemic. So the virus that causes COVID-19 is severe acute respiratory syndrome. Okay, so COVID-19 primarily it manifests as a lung infection, but not only that, with most symptomatic patients presenting with fever and respiratory symptoms. However, it has significant with extrapulmonary, not only pulmonary, extrapulmonary complications affecting most organs systems, including GIT. So here, I'm just including all the extrapulmonary complications. I want to highlight here for the gastrointestinal, which it's causing diarrhea, nausea, vomiting, abdominal pain, and also anorexia. Okay. So if we look into the studies here, okay, this is from China, the pooled prevalence, okay, symptoms where anorexia is the common, about 26.8%, followed by diarrhea, which is about 12.5%, and nausea, vomiting, 10.2%, and abdominal pain, about 9.2%. And this study is the early meta-analysis, okay? The subsequent meta-analysis, which is involving more than 18,000 patients. Okay, so here diarrhea is common, about 11.5%, followed by nausea, vomiting, about 6.3%, and abdominal pain, 2.3%. Okay, so with that, I would like to conclude, okay, my presentation, and these are my references, and I would like to express my thanks to this wonderful opportunity here, and I hope it will be very useful and beneficial for you. Okay, I hope you have gained something today with my presentations. Thank you very much.
Thank you very much, Dr. Vimala.
Yes, welcome.
Yes, it's very clear presentation, and now we come to the discussion session, Doctor. This session will last about 1 hour, and I would like to invite one person who will ask the question and will be answered directly by Dr. Vimala, and so on until the session over. Now we invite students, alumni, or all audience who want to ask. You can raise your hand or chat. Okay, for all students. Okay.
Okay, let me start maybe. So let me ask one question so that they can be familiar with the questions. So what are the main symptoms when we talk about gastrointestinal infection? What are the main symptoms that you think? The main and common, because from each and every slides, I keep on telling this is the common symptoms, right? So what do you think? What are the main common symptoms? You can unmute, you can talk to me, or you also can put it in the chat box. There are main 4 symptoms.
Okay, student, you can unmute if you know the answer, the main symptoms of gastrointestinal infection. You know, this is important. This is very important. We just don't know. We just need the knowledge about the physiology and pathophysiology, because from there we can conclude the diagnosis and the treatment, because
Yes.
there are so many clinical symptoms, but in different causes is different significant clinical symptoms, yeah, Dr. Firmala, yeah.
Yes.
Okay, because in the medical doctor, if in the village course, we need to treat the patient fast and very fast, yeah, doctor. So, how about Ricky Rich? You want to ask?
Excuse me, doctor.
Yes, ma'am.
Yes.
I'm about to answer the question.
Yes, please.
I'm about to answer is about abdominal discomfort.
Yes.
The vomiting and nauseous, acid reflux, fatigue, loss of appetite, difficult of swallowing.
Yes, you're right. So these are the main symptoms. So it will always start with abdominal discomfort, nausea, vomiting, diarrhea, fatigue. When there is a diarrhea, it continues with fatigue. Okay. Reflux, all that. Thank you so much.
Okay, thank you very much, Titus Emmanuel. And is there all student who is want to ask Dr. Firmala? If you don't ask, because Dr. Firmala will be ask you.
Yes, I will pick up you randomly.
Yes.
Then I will ask you.
Excuse me, doctor. I'm about to ask. I have some question.
Yes.
First question is, the people is have a proctosigmoiditis disease.
Sorry, what disease? Come again?
Proctosigmoiditis.
Proctosigmoiditis. Okay.
I want to ask about what is a common symptoms of the disease, and according to the WebMD, it can be cured. There's no way to cure the proctosigmoiditis, but it can be a long life disease. But how can we manage the from the disease maybe? And I've read too, the chemotherapy is one of the choice of the treatment. Is it true, doctor? Thank you. Okay.
So before I answer your questions, can you tell me what is sigmoiditis?
Is a ulcerative colitis chronic, doctor?
Yes, it is the type of ulcerative colitis, correct. So this proctosigmoiditis is actually depending on how much your colon and rectum is affected. Okay, it's depending how much the colon and also rectum is affected. So The symptoms also can be less severe, depends on the length of the infections, how much the colon and also rectum is involved. Okay, so always the flare-ups, you can see the flare-up it can cause a lot of pain and also affect your, I can say it can affect your health-related quality of life as well. So it depends. So it can be curable. Sometimes there is no cure in the conditions. Okay, so a lot of researchers and also a lot of medical evidence says that the treatment, the chemo, okay, it depends whether the condition, it is the possibility whether you can manage the symptoms or not. So if let's say you can manage the symptoms with the conditions of the patients, definitely yes, you can make it can prolong their lifelong as well. Okay. So did I answer your question?
Yes. And I have another question.
Yes.
We can diagnose the disease from the color of the stools.
For proctosigmoiditis, is it?
No, it's another question.
Oh, another question. Okay. So, okay.
We can diagnose the disease. I'm reading the journal from the WebMD2. And then tell me about we can diagnose the disease from the color of the stools. What is the number color of the stools in any type of stools, and how we know it's infection disease only from the stools colors, and the mechanism is. Thank you, doctor.
Okay, so what I will do now, I'll go back to my slide. Okay, I will show you the okay. So this is the stool chart, right? I mentioned just now, correct now. So these are the types of stools, but the color is still remaining the same, which is brown. Okay, apart from brown, if the color is in a dark, black terry stools. Have you heard the term black terry stools?
Yes, doctor.
Okay, so if it is a dark black terry stools, what do you think?
It is a normal color.
Dark black terry stools.
It's not a normal color.
Yes, of course, it's not a normal because it is dark black terry stools. So that means it's very, very black, dark blacks. So if the color is dark black, you know there is a bleeding. So you must know whether it is upper GI tract or lower GI tract. Usually, if upper GI tract, the color will be dark black. If it is lower GI tract, the stool will mix with the fresh blood. Okay, another one, if we want to talk about the color, yes, the color is more to, examples I give you, more to grayish, gray colors, gray whitish color. That is also another type. Okay, so that is because unable to absorb, digest and also absorb the fat. So that is the reason. And also if you look into the children's, okay, children like infants, children, toddlers, some of them, the colors can be greenish. That is due to the bilirubins. Okay, so these are the different types of colors, but colors are much more lesser compared to the types, because we always need to look into the types. Always the types will significance with the conditions. Okay.
Thank you, doctor.
Welcome.
Thank you very much, Titus, Mr. Titus. Yeah, there is so interesting question, doctor. It's about proctosigmoiditis. Yeah, I think it's a high question for the medical doctor, but it's okay, doctor. Yeah. Okay. I think want to first about the treatment. The first choice is I think it's 5-amino salicylic acid, yeah, or mesalamine, but and combined with oral corticosteroid too, yeah, Dr. Vimalaya. But you can combine with surgery, I think. But this topic is about physiology and pathophysiology. Yes, yeah. I think we have a question about that, yeah, about the treatment maybe in another guest lecture, because we need knowledge about physiology and pathophysiology to answer and to diagnosis and to treat the patient. Yes, Dr. Vimala. And now we're going to the next asker, to the student, to all students.
Excuse me, doctor. I would like to ask a question.
Okay.
Yes.
Your name?
My name is Caroline Koswara.
Okay.
Allow me to ask a question. Since developing countries have yet to make advances in treatment like those in the West, how do these countries cope with gastrointestinal diseases?
So, do you think that developing countries, from your knowledge maybe, okay, you have read a lot of books, you have read the journals, so do you think the developing countries, like Western countries, are good in their advanced technologies and also treatment to the patients?
In my opinion, though, the Western country has more advanced treatments and technologies rather than in developing countries.
Why do you think, like, we still in a developing country still lacking in that?
There's also in the financial situation as well, doctor.
Okay, so the name itself, we are still in the developing countries. So developing countries, we need to upgrade a lot of things, not only medical term, okay, a lot of terms, a lot of things that we need to upgrade, and also number of patients, okay, usually number of patients in each and every hospitals. So we still need to upgrade each and every systems in hospitals. So in that wise, we are still a bit down compared to them. So in future, what we can do, of course, we need to create more, we need to study more, we need to research more so that we can balance everything. So we are still in a process of going forward, upgrading our countries, our systems, our health systems, our health environment as well. So that is the reason. So that is why always studies also can compare developing countries and also Westerns, developing and Westerns. So this is the reason. So how do we need to cope up? How do we need to upgrade ourselves? So by doing a lot of researches, by upgrading our system, our environment, our health environment, our ministry maybe. Okay, so that is the reasons. That is what we can do.
Thank you, doctor, for the answer.
Welcome.
Thank you, Dr. Vimala. Thank you, Ms. Caroline Koswara. For the next asker, I give a place. Okay, please. You can unmute. Thank you, doctor. About gastroinfection symptom in COVID-19 is now very interest topic, doctor. Is about how to different that. clinical signs of gastrointestinal causes of COVID-19 and to the other causes, doctor. Thank you.
Okay, so basically, we know that all the gastrointestinal infections or all the symptoms for our GI tract is almost the same. Am I right? So we are having abdominal discomfort, we are having diarrhea, we are having nausea, vomiting. Since studies shows that, because we know that COVID-19 only pulmonary, it starts with pulmonary, okay? Because acute respiratory distress syndrome will be there. But when it involving extra pulmonary, it also involves the GI tract. So how does it involve the GI tract? Like I'll show you here. Okay. One moment, I will show you. Okay. So in gastrointestinal for COVID era, COVID-19 also having the same diarrhea, nausea, vomiting, abdominal pain, and also anorexia. So this is because the virus, which is already in all the systems, when it reaches our intestinal, the how to say, like the virus, it getting spreaded, okay, spreaded to the guts, so it involving and covering all the gut layer, laminar layer, so it like producing the intracellular, extracellular fluids all get disrupted, so increase in all the secretions, and also like giving you more production, secretion of large and also small bowel, and cause the diarrhea. And another thing, patient also will claim that they don't have appetite to eat, anorexia. Definitely it will easily cut down all the appetites. Why? Because the productions of enzymes starts from your mouth, saliva, then move on to the gastric juices, pancreatic juices, also been reduced because of the spreading of this virus. And also, not only that, the secretions of the juices been reduced, secretions of the enzymes, okay, enzymes which totally been shut, okay, unable to produce, unable to, all the organelles, all the cells are unable to work normally, properly, because of the spreading, okay, the actin, myosin, and also the filaments of the each and every muscles when they are reacting, so that the muscles in the guts unable to work properly. So all these are giving the symptoms to your GIT, your tract GIT infections. So it giving the symptoms like diarrhea, vomiting, nauseated. So these are the main cause during infections in a COVID era. Okay, patient also complaining about abdominal pain, abdominal cramp. Why? Because of the muscles, abdominal muscles, unable to, we know that muscles, all the muscles, you need calcium, calmodulin. So the release of calmodulin is not proper, so that also will cause all the abdominal pains. Okay, abdominal muscles are involved. Okay, nausea and vomiting also. The nausea, our sympathetic, our parasympathetic not giving signal to the digestive. Okay, here also involving our cranial nerves. So all these are involving and giving the role to the GIT to give the symptoms during this. So that's why what we can do, we only able to treat symptomatically. We don't have a exact or proper medication. Okay, for COVID GIT, you must eat this. No such things. So for GIT, yes, symptomatic only. For nausea, vomiting, we can give symptomatically. Diarrhea as well, symptomatically, IV fluids. So that is what we can do. And also we need to encourage the patients to eat, to drink. So that's it, I think.
Okay. Thank you very much, doctor. So we must be careful because the patient COVID-19 not to come to hospital only with respiratory tract symptoms, but the prominent symptom can be the GIT infection.
Yes,
doctor.
exactly, doctor.
How to the most common is presenting symptom is anorexia, ya dokter ya?
Yes,
Yes,
correct. According to the studies,
yes,
anorexia was the most common symptoms. So in that case, don't think if your patient is in hospital only with diarrhea, don't think patient is having, for this era I'm talking, so don't think patient is just having diarrhea, so this must be due to GI infection. No, you also must check the COVID, whether patient is positive or not.
we must be careful.
Yes.
To medical doctor because they are already in unit emergency. Okay, thank you very much, doctor. And to the next asker, I give the floor to the student or the all audience or the lecturer too or alumni. There is a alumni in here.
Excuse me.
Okay, please, your name.
My name is Francisca.
Okay.
Okay. Excuse me, doctor. I want to ask you this about general question. I'm very curious about why people who have like in developing country, there is a lot of poor people. They have poor hygiene, something like that. But why they are the most people who rarely get infection, and we are who get a good wealth and eat healthy. It's really easy to get the infection. I mean, like our body used to have an immunity or compensation to where we are. I mean, like if we like poor people, they don't have good money to eat like healthy, so they eat like what they have, and yeah, kind of like that.
So it's like, do you asking me like why poor people also getting infection and we eating good food, like we are in a good condition also getting infection? Is it so?
No, I mean like the poor people. I mean like, okay, we say the poor people, all the people who get a mental disorder, they eat everything, but they are the most people who rarely get the infection. I mean like they get, but the mostly people who get infection is the people who have like good wealth and eat properly like that.
Okay, so you are, for example, let's say you are getting a good wealth and you are eating proper food, right? So what do you call your food as a proper food? What type of food is that you think it's a proper food?
Oh, okay. Like we eat like fresh fish. We cook it. We cook it really good. We wash it. We cook it properly. Like we buy it from the market, and the poor people, they probably get it from the traditional market, something like that.
So here we can't compare the good market and traditional market. Okay, good market, no contaminated. Traditional, yes, it is contaminated. Not exactly it is, because even still in a good market also it still can be contaminated, because in traditional market nowadays, from what we have studied, in traditional, the more fresh will be reach the traditional first compared to the good market. Why? They will preserve everything and they will make it everything fresh. So that is one point. So you think it is fresh, you think it is good, but you don't know how many days it was preserved there. That is one point. Okay, and you think in a good market you will get a good vegetables and you can make a very good raw salads, but you don't know how many days the vegetables are there in a good market. Okay, now we are in a very technology era, I would say that. So everything looks beautiful, everything looks neat, clean, but it's all with chemicals. compared to the, for example, the traditional market. You can see they're just putting it in a floor with the muddy. Okay, it looks dark. Okay, and everything. But in a good market, everything is fresh. But you don't know how much chemicals are contained in that fresh vegetables and also fish. That is the main reason why we are still, even though we're eating a good food, we're getting a good things, okay, we're getting a fresh from the market, but still we are getting infected. That is the one main thing.
So like a lot of people who live close to the river and they wash their food there. I mean, like, is our body have a compensation to what we eat every day?
Yes, that is true. That is one thing. Yes, we have our compensation, like what we are eating every day, what we are used to eat, how our antibodies are reacting to it. That is one thing. Okay, and also, for example, like you mentioned, staying at the riverside, washing everything in the river. Also, we don't know the water, it is clean or not. But still, their bodies can compensate, can fight because they already built with their antibodies. If we go and wash our things, our fruits, our vegetables in the river, okay, water in the river, then if we want to cook any, that is totally different story. Okay, our body will react different way. Okay, so in this case, each and every human's body, their antibodies and antigens also react accordingly. Okay, apart from these infections, apart from this bacteria, their antibodies also reacting in a different ways. So how much you can fight, how much you are unable to fight. Are you having any underlying? For example, you are eating clean, but still, let's say you are a known example, not you, like example, the patient is known case of asthmatic patient. Okay, patient, so having underlying asthma patient or eczema. So we know that definitely their antibody is much more slower or much more weaker compared to the normal one. So definitely the easiest infection also can affect them and giving all the symptoms. Okay?
Okay, doctor, thank you.
Welcome.
Thank you very much, Resika. Miss Resika, thank you very much, Dr. Femala. I think about pure country, how can get infection is related so many factors to
Yes,
get
exactly.
GIT infection, doctor. There are internal factor and external factor.
External factors as
Yes.
well.
The external factor may be the pure country is relationship with low education, resulting lack of knowledge about hygiene and clean lines, and relationship with low economy can make low nutrition, maybe like that, yeah, doctor.
Exactly. Their social economic is different if you
Yes.
compare each and every one.
Yes, doctor. There is so many factors, Resika, to make the GIT factor is host and inang, yeah, internal and external factor. Okay, thank you very much, Dr. Femala. And to the another asker, I invite you.
Excuse me, doctor.
Yes.
Okay, Caroline.
I would like to ask a question. So what's the trigger for some COVID-19 patients to get gastrointestinal complications while other COVID-19 patients do not have any?
Okay, according to studies, this COVID virus, okay, not only affecting not only involving your respiratory tracts, okay, like it can go extrapulmonary, but the findings or the triggering factors, still it is under studies. So suddenly patient can come up with GIT infection, suddenly can come up with any other endocrine infections. So if we want to tell you like exactly what is the triggering factor, no, we don't have exactly the answer what is the exact triggering factor. So this virus can go any part of your body, can trigger any part of your body, any system of your body, and when you do the test, it comes positive. So until now, the researchers, okay, the studies are still going on. So we don't have specific answer why it is GIT tract, how it is triggering GIT tract. No. It is just going and involving all the systems so that suddenly you can come up with your symptoms. So you don't know that it is the COVID symptoms. So from the result only, after we do the test, antigen, okay, then only when it is positive, we know, oh, this is one of the symptoms. So that is how it is going now for the past a year plus. So we need to do more studies and researches on this, like to find out what is the exact reason for the triggering factors.
So it's still unknown, doctor?
Yes, it is still unknown, and we are still studying on it.
Thank you for the answer, doctor.
Welcome.
Okay, thank you very much. To audience, you can ask in the chat, but please, you can setting the chat to everyone because I can see the asker your question because you setting to the IT. Okay, there is one question in the chat from Mr. Sharma. In refer to slide number 8, in slide number 8, what is your opinion about the high rate of GIT infection in developing countries, doctor? Thank you.
Recording. Okay. So in high developing countries, like what is the infection rate? Is it so? Like the questions, moderator? Can you repeat me the questions?
Okay, the question is, okay, according to slide number 8, what is your opinion about the high rate of GIT infection in developing countries?
Okay, so we know that in developing countries, each and every social economic status are different. Okay, so that is one of the factors, like we mentioned just now, the internal external factors. So this is one of the factors because maybe we are lacking of a lot of things. Okay, we're lacking of every factors. It can be internal, external factors. So this is one of the reason why it is lacking in developing countries compared to the Westerns. It's involving many factors. Okay, starts from our socio-economic, education, okay, our health, environments, all that involves. So that is the reason increase in developing countries compared to the Western.
Okay, thank you very much, doctor. I interest to know. There is a table, but I forgot what the slide, what number the slide. It's about to know different diagnosis GI infection. We need a test, doctor. I think the first there is osmolaritas, stool fat. I think there is
diarrhea, I think.
To know different diagnosis, yes, this is one.
Okay.
So I think clinical symptoms significant in osmotic, secretory, malabsorption, exudative. There is a test. We need two different diagnoses. So it's the its relationship with physiology and pathophysiology about the etiology causes gastrointestinal infection, doctor. In example, in secretory, we look there's osmolaritas is decreased, but in osmotic is increased, doctor. And another test too in malabsorption and exudative too is a different significant test. So how we know to relationship with the test and the physiology and pathophysiology, why the test is have a result that. Thank you very much.
So when we look at the secretory type, we know it is increase in electrolyte secretions. So when it is increase in secretions, it can also cause the decrease in absorptions. So when increase and decrease are there, it will persist during fasting, because fasting we are not doing anything, all right? We are not eating, so the process is not occurs there, so it is persist. But this is pathological condition, right? Because patient is having diarrhea, so toxins produced by bacteria pathogens are there. So a lot of toxins are produced. When a lot of toxins are produced, automatically secretory, that's why it is increasing in secretions because of these toxins by pathogens. And in malabsorptions, when we talk about malabsorption or maldigestion, we generalize the digestion is not there, the failure to absorb all the nutrients and also all the digestions food unable to absorb because it's already failure. Okay, when the food is there unable to absorb, okay, definitely fat, okay, will increase fat in stools. So the gap will be there, which is less than 50 milliosmol in kilogram in body weight. So it is because unable to absorb. So the pancreatic insufficiency, pancreatic juice won't be there, not enough also. Either it is not enough or not there, okay, to absorb. The juices are not there to absorb. So that is the reason unable to absorb or failure in absorptions, but also it is relieved by fasting. Okay, it is relieved by, because when it is fasting, you're not taking anything, okay, it is emptying, so nothing is there for you to absorb. That is the reason. Okay.
Thank you very much, doctor. I think this is the point why we must study about the physiology and pathophysiology about gastrointestinal infection, doctor, because we know about the physiology and pathophysiology, so we know and we remember how the test, why the test result that, because the relationship not only to know the treatment, but we know how physiology and pathophysiology, so we know what the result of test, because the physiology and pathophysiology, that's the point, all students, why we are studying in this morning about it.
Exactly. We must know the normal condition first, the normal physiology. Physiology means the normal, it is normal. This is how it is, that is physiology. So when we know the normal cause, normal pathway, how does it goes, then only easy for us to understand the abnormal. So when we understand the abnormal, easy for us to rule out the diagnosis as well as we can carry out with the treatment.
Yes, I think it's very interesting, doctor. Thank you very much for your presence. And now I give the time to another actor. To all students, you can unmute that. Or we can ask you. We random to choice to ask you. There is no ask.
I think they have covered everything. They understand with all the slides.
I think they understand, so we must ask them here. Okay, how about Jenny Halim? Do you have a question there? Jenny Halim?
Yes, doctor.
Do you have a question or we are want to ask you?
I think I don't have a question, doctor.
Oh.
Do you understand about today's topic?
I understand a little bit, doctor.
A little bit. Why a little bit?
If you not understand, you can ask there. Maybe we all want to remember that what there is so many gastrointestinal infection, doctor, like gastroenteritis, diarrhea, dysentery, enterocolitis. May you to present what the significant clinical symptom about that gastrointestinal. Do you have the table or how to fast to remember that, doctor?
So when we talk about the clinical significance, I think this one. So when we talk about clinical significance in GI tract, gastrointestinal infections, so these are the common in clinical significance for gastrointestinal tract infections. The patients with GI infection always comes with nausea, vomiting, diarrhea. So when there is a diarrhea, when there is a vomiting, definitely weight loss will be there. When weight loss is there, because already few times of losing stools, vomiting, so weight loss, patient will look very ill, very fatigued, lethargic will be there. Okay, so also will cause, name itself gastrointestinal, so stomach, abdomen region. So definitely it will cause pain. Okay, so recurrent abdominal pain is the most common in GI infections. So in vomiting and nausea, so why the patient can vomit? What makes him vomit? So first thing which is common is food poisoning. If you eat anything wrong, okay, if you are eating something which is not supposed to eat, definitely it can lead to poisonous. So food poisoning. Then gastritis, ulcer, gastroparesis, overeating. Okay, overeating also. If you are eating a lot, okay, definitely it will cause you vomiting. Gallbladder disease, because unable to emulsify the fats, okay, the bile unable to emulsify the fats. So also can cause gallbladder diseases and also congestions, bowel congestions. So these are the common things in nausea and vomiting. When we move on to weight loss, so weight loss is already severe compared to vomiting and nausea. Okay, when it is weight loss, we need to rule out why there is a weight loss. So when the vomiting occur, when the diarrhea occur, for example, so for how long? Does it chronic, acute or chronic? So if it is chronic, because weight loss always occur when the symptoms are chronic. In acute symptoms, we will not find any weight loss. So if it is chronic, then only we know, okay, something wrong. So we need to rule out further with further investigation. Or is there any inflammatory or any malignancy? Or it is just the ulcer, or maybe the ulcer can lead to malignancy. Okay, if weight loss, it is the chronic conditions. So with all these symptoms, definitely patient will be fatigued. But how long? Is the fatigue can be cured, or patient claiming that having fatigue throughout the journey? So that means you need to do a proper investigations. Why? What is the reason? So in irritable bowel syndrome, definitely patient having fatigue. Fatigue is one of the common symptoms in irritable bowel syndrome. And also if patients are claiming abdominal pain, that is also you must ask for how long. What are the significance? So if it is chronic, okay, if it is acute pain, you can think of gallstones, gastritis, or maybe you can think of any strain or pulled in abdominal muscle. But if it is a chronic pain, okay, you can think also about bowel syndrome, irritable bowel syndrome, malignancy, and stomach flu. So this is how you need to know. Okay, first of all the significance, clinical significance, you must know whether it is acute or chronic. Duration basis. Remember, one slide I showed to you the duration basis. So you must know the duration, whether it's a short duration or long duration. If short, for how many days? Long duration also for how many days? So from there you can conclude what are the investigation that need to be done in your patient, so that you can rule out with the proper diagnosis and treatment. Okay.
Okay, thank you very much, doctor. So if your patient come to yours, too, and then you must have a step to diagnosis that what is the prominent clinicals, and so what there is acute or chronic, yeah, doctor, yeah,
Yes,
and the prominent clinical significance is like vomiting and nausea, weight loss, fatigue, and recurrent upper abdominal pain. And in the weight loss, I think we can to add that HIV too, yeah, doctor. HIV.
HIV.
Yeah, HIV.
Yes, correct.
Thank you very much, doctor. And we still have the time to discussion session. So to the student, please, to the asker. Okay. To alumni too, in this event, not only a student come here, so to the alumni, lecture too, if you have a question to Dr. Vimala, you can ask in this discussion session, please.
Okay, one more thing I would like to share here. Remember, in the clinical significance, I put here gastroparesis. So we must know what is gastroparesis. It's also one of the important part here, because it is a long-term, it is a chronic conditions. Okay, this gastroparesis, like chronic condition where the stomach, our stomach is unable to empty in the normal way. So it is the chronic conditions. Okay, why? Because the food we are eating, it is passes through the stomach slower than usual. Okay, very slow than usual. So it also thought to be the result of a problem with nerves and also muscles which involving in it. Okay, so we know usually the nerves and muscles can control the stomach empty time, but here it will be much more slower because of the nerves and muscles unable to control it. So it will be much more slower compared to the normal condition. So this is a long-term condition, okay, or we call as a chronic conditions. Also one of the important. So patient, because emptying time is late, okay, food is very slow passing through it. Also easy to vomit. Okay, nausea will be there and easy to vomit. So this is one of the conditions. Okay, thank you.
Thank you very much, Dr. Vimala. I think the time is past, so now discussion session has ended. Thank you for sharing with us, Dr. Vimala.
Doctor, I would like to request,
okay.
I would like to show my university here.
Oh yeah,
my
okay.
session, okay, I will show you. Just a small sharing with my alumni and also my other friends.
Okay, doctor, time, floor is yours.
Okay, thank you. Okay, so here, okay, I'm working in Ames University, and this is my green campus. The campus is about 230 acres, and it's a green campus. We call it a green campus because everything is green. You can see from the picture, it's surrounded with the trees and also mountains. So here we have about 500 and plus staffs, and 7 faculties are there, and we are also having 15 undergraduate programs and also 13 postgraduate programs, including masters and PhDs. And he is the Chancellor of Ames University, okay, Yang amat berbahagia Tun S. Samiwelu, our Chancellor of Ames University. And this is our convocations. I just want to share a night of convocation. This is usually, we will do a night before convocations where we will put the stalls to sell the bouquets, flowers for the graduates. Okay, this is how it looks a night before convocation usually. And this is the interesting or main part of my university. That is the library. So I would like to share that the library is the largest, second largest in Asia. Okay, this is the library, and apart from that, this is overall the evening view of the university. And it's a great hall where all the convocations, will be here, can accommodate about 3,000 plus packs. And also we are having swimming pools, stadiums, and all that sports complex. So it's just a sharing with all of you, okay, about the university, and all of you are welcome to Ames University one day. Maybe we can do a study tour, right? Thank you so much, Doctor, for the opportunity.
Thank you very much, Doctor. It's a beautiful university and very bigger, Doctor, and very green too.
Yes.
Maybe after the epidemic, we can go into there with
Exactly.
study.
Yes, yes. Always welcome.
Okay, send greeting from us to the counselor and all lecturers, Doctor,
Definitely,
in Ames
Doctor.
University.
Thank you.
Thank you very much. Thank you for sharing with us, Dr. Vimala. It doesn't feel like time has passed quickly. And from this guest lecture, we can conclude so many, such as that one is gastrointestinal infection causes is so many causes, such as E. coli, enterocolitis, Vibrio cholera, Shigellosis, Helicobacter pylori, and also COVID-19. And this digestive system consists of several organs from ingestion until to the defecation. GI system have many functions such as digestion, absorption, secretion, and defecation. Gastrointestinal infections are responsible for substantial morbidity and mortality in worldwide. So we need know light that. So about physiology and pathophysiology, gastrointestinal infection. Okay, to know the different diagnosis gastrointestinal infection, we need so many tests about osmolarity, stool fat, fecal elastase, serum CRP, fecal calprotectin, and leukocytes. And E. coli make a G infection have a 4-step like attack, enterotoxin delivery, enteropathogenetic, enteroinvasive, enterohemorrhagic too. And COVID-19 so have a clinical symptom, gastrointestinal infection too. So we must be careful to diagnose COVID-19 with a GI infection. The poor country have a relationship too about a gut infection. Gastrointestinal is about a low factor internal and external too. Okay, Doctor, due to the limited time, it is with a great regret that we have to end this event. But before we close this event, we will end it by praying, which will be led by Mrs. Pendeta Rustina. To Mrs. Pendeta Rustina Ginti, we give you a floor. Please, Mrs. Pendeta Rustina.
Sudah? Ya. Mari kita berdoa. Damai sejahtera Allah yang melampaui segala akal, itulah kiranya memelihara hati dan pikiran kami ya Tuhan, sehingga ketika kami mengikuti rangkaian acara seminar kuliah tamu pada hari ini, kami merasakan kuasa Tuhan, bahkan hikmat Tuhan. Melalui seluruh rangkaian acara ini, kami semakin diberikan hikmat bijaksana, sukacita, damai, sejahtera, bahkan pengetahuan yang baru di dalam kesehatan. Semua peserta seminar telah menerimanya dengan baik, ya Tuhan. Oleh karena itu, berkatilah kami semua, ya Tuhan, peserta seminar ini, sehingga kami dapat memanfaatkan seluruh pengetahuan yang telah didapatkan pada hari ini. Terima kasih ya Tuhan, di dalam nama Yesus kami berdoa. Amin.
Amin. Thank you very much, Mrs. Pendeta Rustina Ginting. So that we have a beautiful memory on this day, it will be nice if we took a photo together. To all audience, students, we invite you to open the camera. We give a time to all audience. We invite you to open the camera. Okay. I think everybody open the camera and we can smile and sweetly. Okay, in slide 1, 2, 3. Slide 2. Okay, in slide 3. Okay, thank you very much. Thank you very much, Dr. Vimala. Nice to meet you, and I hope you stay healthy, doctor. And we very happy to see you in Zoom. Yeah, I think it's not like guest lecture, but it's like reunion.
Yes,
Yes,
exactly.
yeah, doctor. Yes, I think we 12 years there not to see that, doctor.
Exactly.
Okay, thank you very
Thank you
much.
so much. Thank you for the wonderful opportunity. I'm happy to be back to my university. I would
Yes.
proudly say that.
Okay.
Thank you to all of you.
Thank you very much, doctor. We still contact, okay?
Yeah, sure.
If we go on to going to Malaysia, yeah,
Yes.
to study tour or to shopping, doctor. Okay, okay, doctor. I will end this event with a poem in bahasa. Daun kelor sangatlah lebat, orang sakit ayolah berobat. Terima kasih wahai sahabat, kebersamaan kita bersama sangatlah hebat. See you again, ladies and gentlemen. FK UMI selalu jaya. Tuhan memberkati kita. Thank you.